Hello, hello, my beautiful, gorgeous, lovely, lovely people. Today we're going to go over asthma. Now, this is going to be a short review, might be a 2 minute, a 3 minute review. Now, specifically, we're going to go over the drug therapy, the drug therapeutics for a patient with asthma. Now, as we all know, it's a form of COPD disease in which there's spasms and inflammation in the airways, right? Usually, the patient, when we assess, would have wheezing, right? Now, in regards with pharmacology, the most common drug therapy would be your bronchodilators and your beta adrenergic drugs. Also, some steroids and maybe some mucolytics, right? Now, with beta adrenergic drugs, the most common would be epinephrine or adrenaline, which is used as basically an anti-asthmatic. It's a bronchodilator and it has adrenergic effects, right? Now, when we talk about some of the most common bronchodilators have what we call anticholinergic effects, right? Now, anticholinergics basically is a group of bronchodilators that differs from our beta agonist, like I mentioned before, because beta agonist usually affects the bronchioles, or basically the small airways in the respiratory system. On the other hand, with anticholinergic, it affects the bronchi, or the large airway in the respiratory system, right? Now, anticholinergics is further classified into two types. You got your short-acting anticholinergics and your long-acting anticholinergics, right? Now, most common short-acting would be your ipratropium bromide, right, or Atrovent. And with long-acting anticholinergics, the most common would be tiotropium or Spiriva, right? Now, remember that the side effects with anticholinergic drugs are mostly dry mouth, blurred vision, and dry cough, right? Now, let's talk about respiratory acidosis and respiratory alkalosis. Um, uh, Relevant to a patient with respiratory ailment. Now, when we're talking about respiratory acidosis, it's basically an excess of, as we all know, carbon dioxide in blood, which is what we call hypercapnia, right? And the PaCO2, or the pressure of carbon dioxide, is greater than 45 millimeters of mercury, right? Now, when we talk about the pressure of carbon dioxide, it's basically the alveolar ventilation, right? So, with a patient with respiratory acidosis, there is a reduced in alveolar ventilation. On the other hand, with respiratory alkalosis, there would be a deficiency of carbon dioxide in the blood, which is what we call hypocapnia. Therefore, there would be a decrease in PaCO2, right? And the pressure, the pressure of carbon dioxide would usually be below 35 millimeters of mercury. Remember, the normal is about 45, right? And the PaCO2 would be below 35, as I mentioned before, 35 millimeters of mercury when we assess our patient. Therefore, the pH levels would be elevated with these patients, okay? Now, again, going back to drug therapy for a patient with asthma, when we're looking at epinephrine, remember that obviously has an anti-asthmatic effect. It's a bronchodilator, right? And adrenergic effects. Now, the side effects can involve restlessness, nervousness, tremor, and what we have to look for is and watch out for is angina, and it could also cause hypertension and tachycardia in the patient. Okay. Very quickly too, we can also give the patient steroids, right? The most common types for a patient with asthma that you would most likely encounter in the NCLEX are hydrocortisone, your beclomethasone, and your triamcinolone, right, or Asmacort. Also, we could give mucolytics, right? With the thick phlegm and the mucus. The two most common are the acetylcysteine and guaifenesin, right? Um, so I think that's it, guys. I just wanna fairly go over, drug therapy for patient with asthma, and I will see you guys on the next video. Make sure to subscribe. I really, really appreciate you guys. Hope you guys have a great day today. Okay, enjoy the day. Get some sun. Get some brisk walking. Get some dopamine, some serotonin, some endorphins. A little walking doesn't hurt anybody. And I wish you guys the best. I will see you guys in the next video. Thank you so much, and God bless. Thank you.